we have some people trickling in. Thanks so much for joining us. And as people come on over from Hopin, if you could please, if you're able, enter an answer to this question in the chat. And the question is how the COVID-19 crisis has affected the care and education needs of young children in your life. And that could be your own young children, your family, your friends' young children, young kids in your community. Thank you, Sarah. Significant decrease in participation in public pre-K. Unfortunately, that is what we're seeing across the country. Dramatic decreases. That's a really tough decision. Rochelle, I hope I'm saying your name correctly. Thank you for giving these answers. And for those of you just joining us, if you're able, you can enter your answer to this question. We're talking about how young kids in your family or young kids of your own or of your friends or in your community are being affected by the COVID-19 crisis. Sarah, I like how you mentioned trust. Trust is a huge, huge, huge thing right now in childcare and early care. For sure, Erica, we're going to talk about how this is exacerbating disparities.
Let them know we trust them and believe them to do their work, believe them to guide our decisions and our policies.
All right.
It's like a pandemic.
I think if you could all mute, I put this mute reminder at the top. It's like the 2020 mantra. Please mute your microphone. We'll get started in just a minute. All right, I'm going to kick us off just because we have a limited amount of time as people come in. Oh, I'm glad you mentioned food insecurity. That's a huge issue. Fear of seeking community resources, yes. Yes, we're going to talk about the workforce, Neil. Thanks for bringing that up. All right. So let's start things off. Oh, social emotional development is a big one. Please continue to chat, enter your answers into the chat, and that goes for the whole session. I'd love, love, love to keep this chat going so you can share ideas and thoughts and reflections and information with us. So I am Carrie Gillespie. I'm a senior analyst at EdTrust specializing in early learning. And for those of you who were at our last in-person gathering, I was not there because I was out on family leave having my first baby, which made this whole early learning field much, much suddenly more real to me. So I have that new perspective I'm bringing this time. And I'm so excited to introduce Kenny Francis. Kenny is an educator and a child advocate who previously taught pre-K and kindergarten at several New Orleans schools. And he later served as director of school support and improvement at the Orleans Parish School Board. He's currently the director of policy and advocacy for Agenda for Children, which is Louisiana's largest child advocacy nonprofit. He's originally from Brooklyn, New York, and he received his undergraduate degree from the University of Virginia. Thanks so much for joining us, Kenny. We're so glad you're here.
Thanks for having me, Carrie. I'm glad to be here with y'all.
And I'm sure there's some Brooklyn folks in attendance, so they'll be happy to know you're from Brooklyn. So circling back to this question, I see more responses here. And we're going to be covering a lot of this, but I will say we have such a short amount of time and this issue is so huge that we'll really only be able to touch on these things. But I hope that you'll look at the resources we provide in the chat. And after the event, you'll get a bunch of resources on all the aspects of early childhood education during this pandemic. So I want to start with taking a step back and reminding us about what was going on before the pandemic in early childhood education and all the inequities that there were. The data in early childhood is so hard to come by. Even K-12 has a lot of data that we just don't have in early childhood. And as you'll hear me say probably a lot during this session, part of that reason is because we don't have a whole cohesive system for early childhood ed, because we don't treat early childhood education as a public good in this country in the same way that we treat K-12 education. So the facts that you're seeing here are some of what we know, but there's a lot that we don't know. So here are some things that we do know. In an Ed Trust report that I'll post the link to from last fall, we found that Black and Latino children had lower access to high quality state preschool programs. And in fact, no states provided both high access and high quality to Black and Latino preschool kids. We also found that Black and Latino children are underrepresented in many state preschool programs. Other research has found that families with higher education levels have higher access to preschool, and the families that have lower access to childcare and early learning across the country are families of color, families with limited English proficiency, families with non-traditional work hours, families of infants and toddlers, families of kids with disabilities, immigrant families, and rural families. And as I'm sure many of you are already aware, the cost of childcare in this country is astronomical. In almost 24 states, the cost of childcare is more than $20,000 a year. And in over half of states, childcare for an infant is comparable to or more than college tuition and fees at a 4-year public college. Which is absurd, right? Exactly. So this has had a huge effect on the inequities that already existed in early childhood, this pandemic. The pandemic is intensifying these inequities, and they're going to persist without major public investment. For a long time, we've been relying on this patchwork of private funding and public funding and state and federal, but it's been very precarious for as long as we've had an early childhood education system, or I don't even like to call it a system because it's such a patchwork. And now it's just getting worse, and we really need public funding, substantial public funding. Since the pandemic, many states have lost 25% or more of their childcare capacity. And then 35% of centers and 21% of family childcare remain closed nationwide. So you can imagine if you're a parent or a caregiver who needs childcare to go back to work, who wants to make sure your child is in a high quality learning environment, suddenly you already didn't have a lot of access, suddenly you have much less access. And there's so much uncertainty. So really early childhood education is facing an existential crisis. So Kenny, I want to just start by asking you how the pandemic has affected early childhood care and education in terms of both access and quality for the young kids in Louisiana.
Yeah, and like I said, again, thank you for having me. Well, first I want to say that when I talk about this, I always refer to ECE as childcare. I use it as a catch-all term to describe people providing care and education for children birth to 4. I use that intentionally because I think we need to do a better job of breaking down the barrier of people considering pre-K and kindergarten education, but everything below that is babysitting. It's all education. From the moment a child is born until their brain is fully developed as an adult, every single moment is a learning opportunity. Every single moment is an educational moment, and we need to treat it that way for their sake, and also to pay respect to the real work and expertise and the quality of service that the women who do this work for children aged birth to 4 are doing. They're teachers just like K-12 teachers. So I use childcare as a catch-all for that reason intentionally. In terms of how the pandemic has affected access. So just a couple of just like realities that we're living in. One, there's massive losses in terms of the financial viability of childcare centers. We did a survey with several partners of ours statewide, and there was over $140 million worth of losses from childcare centers through June. And so that survey is now a couple months old. And so it's even worse compared to that. Many of those centers will not survive long-term without massive public investment, as you mentioned. So that's one thing, is that centers are closing because they were already operating on very thin margins before the pandemic, and the pandemic has only exacerbated that. And so what we're going to see, and what we're already seeing, is that the already significant pre-pandemic challenges around capacity and availability and affordability for families is only going to get worse as the supply of available childcare slots continues to decrease as centers close due to them failing financially. So that's one. Two, costs are going up for providers because there's increased costs related to cleaning and sanitation. Due to COVID restrictions, there's restrictions around group sizes that drives up costs because they need more employees for a less amount of kids. And so those costs are going to get necessarily passed on to families who already can't afford it, as you mentioned. And so that's going to make childcare even less affordable for families who need it. And more families are going to be it's going to be outside of their ability to do. And as you already mentioned, it's going, and someone mentioned in the chat, you're 100% right that the inequities that we already see among socioeconomic and racial lines are only going to get worse, because what we're seeing is that families who are of means, who typically tend to be wider upper middle class families, they're able to do things like afford an individual caregiver in their house that's providing childcare to their kid singularity, or they're able to do things like hire a private tutor. Families that are on a lower income scale can't afford that, and a lot of those kids are sitting at home, and unfortunately, a lot of those kids are sitting at home often alone or with older siblings, because those are the same people who don't have paid leave. Those are the same people who don't have the ability to work from home. And so they're having to choose between their jobs and taking care of their kids. And obviously, they have to choose their jobs to keep the lights on and have somewhere for their kid to stay. And so the gaps that we already see along lines of race and socioeconomic status are only going to get worse, given that we have centers closing down and kids are unable to access childcare, and the public investment isn't going up. Someone else mentioned food insecurity, and that's a huge issue. We know that childcare and school for many, many kids in our country, and specifically in our state in Louisiana, is the place where they get the majority of their nutrition in their day and in their week. And so that's a huge concern right now as folks are at home. We had a thing that was a national program, pandemic EBT, that was providing families with an EBT card for those who would need to be able to buy food during this time. But a huge issue that we had here in Louisiana that many of us were trying to fight against is it completely left out immigrant families, because it's a Trump administration. And so they had a requirement that you had to have a Social Security number to be able to get the pandemic EBT, which means that anybody who's an immigrant who doesn't have a Social Security number, they were not able to do that. This is a community that is growing in our state every single year. And so that's thousands of kids who didn't have access to that. And I think one of the more frustrating parts about that is it has nothing to do with legal status. You can be here legally and not have a Social Security card yet, and you were cut out of being able to get that very essential need. And then there's also a human side of this, where, as we've talked about, kids need to be in quality care. 90% of our brain development happens between birth and when a child is 4 years old, and thousands of kids have been out of care for over 6 months now. And so I saw someone else in the chat mentioned about how they're worried about the developmental progress of their child, and that's true for a lot of families, thousands of families. And then there's another part to this where something that we're seeing is that lots of families are feeling unsafe sending their kids to childcare. And we're seeing families' preferences around childcare changing due to COVID and them trying to protect their families. One person in the chat mentioned having to make a decision between sending a kid to childcare and being able to see older relatives. And that's a very real concern that so many people are having to deal with right now.
Thanks, Kenny. And that's a good segue into thinking about what the providers themselves are dealing with in these shifting preferences and the safety issues. So I want to remind us about what the early childhood workforce was facing, and Kenny, you touched on this. Before the pandemic, there were so many inequities that now, of course, are just made worse. So one thing I just want to quickly remind all of us as we think about this is that most early educators in this country are not in Head Start, they aren't in public school programs, because early childhood ed is so underfunded in this country. And again, we don't treat it as a public good like we do K-12. So most early educators work in small businesses. And many of these small programs receive some government subsidies, but they barely cover the cost of running the business. So on a good day without a pandemic, these providers are running their programs on razor thin margins. And so of course now it's much, much worse. So just some facts here on the slide that we know in terms of inequities. Black preschool teachers earn 78 cents less per hour than white preschool teachers. Black infant and toddler teachers make $1.71 less than white peers. Latino early educators are more likely than their Black or white peers to work as, rather than as a head teacher, as an assistant teacher or as an aide. And in early childhood ed, in most cases, there is no guarantee of health insurance, of paid sick leave, or of a living wage. And there is no substitute. If you're sick, there's no substitute pool to pick from. So this is a really, really hard job, and you don't get into this for the money or the fame or glamour. This is a job of passion. It's a calling. And so these early educators are facing unprecedented challenges right now. Providers of color especially are impacted because they're at this intersection of the inequities in the early childhood system, inequities in the business and banking system, and inequities in the healthcare system. So I want to show a quick 2-minute clip of an example of Celeste from Baltimore. And I'm going to show you just this quick video where she'll tell us about what she's been dealing with. All right.
My name is Celeste Joyner, and I am a family child care provider, and I've been in business now for almost 24 years. During this pandemic, me and my husband had to have a conversation, a very hard conversation, because he was diagnosed with congestive heart failure. So I had to kind of hold things in to see if I was going to become an essential provider or not. He told me he was going to support me. My enrollment went from 8 children to 2 children, and that's a huge decrease in income. Protocols have totally changed because social distancing with young children is very there's not even no more fist bumps. And I have to stop the children and say, no hugging. We can't hug right now. I've always sanitized, but it's a lot more than what I used to. Every 5 to 10, I'm wiping down a chair. I'm wiping down a table. So I go to the store every week and it's nothing there. It's nothing there at all. No Clorox wipes, no Lysol wipes, no bleach, no hand sanitizer. There's nothing there. I hope to stay in business, but the way childcare is going, who knows? We really don't know at this time. We just don't have a clue. Everything is just going to be different with childcare. Nothing is going to be the same anymore. Social distancing, like us, it's very, very hard with young children. It's very hard because they bump up into one another. They touch one another. I mean, children like to touch and they like to feel things. So it's going to be really hard to stay in business that way. I just think it's going to be a little different. First and foremost, I think they should offer us health care. They should raise all subsidies for people who need help with childcare. They need to provide more grants for us as well. And also just make childcare essential. that we are essential.
You hit the nail on the head.
It's just so much to deal with at the same time. And Penny, I'd love to hear from you about this, about how the pandemic, like Celeste highlighted, is just devastating the early childhood ed workforce, and disproportionately affecting women of color. And like Celeste described, enrollment and attendance have plummeted since the pandemic started, and costs are skyrocketing to keep with all these guidelines to keep everyone healthy and safe. So many early educators are leaving the workforce, rightfully, understandably so, because they need to find work somewhere. This means fewer programs are available though for families, and coming out of the pandemic, there could just be far fewer programs available to families in the future, which will of course disproportionately affect families of color and low-income families. And because of the challenges that people are facing right now in accessing higher ed programs, another concern is that there'll just be fewer early educators who can get credentialed and then enter the workforce, which will again affect the diversity of the workforce and women of color especially. So Kenny, I wanted to know from you a little bit more about how the pandemic has affected providers of color in Louisiana.
Yeah, the trend is very similar to what we just watched the video and what folks are seeing across the country. Just some numbers here. So over 90% of the workforce for childcare nationwide are women. Majority of them are Black women. And so when we talk about the burden of what's happening to childcare is happening to Black women, and Black women are the people who are owning many of these small businesses. I saw someone say in the chat that a lot of centers, a lot of providers had difficulty accessing the SBA loans. And that's something that we also saw here in Louisiana as well. We had a partnership with United Way and with the Loyola Law Clinic here to try and help, but you can only help so many people with the resources that we had. It's not like we had the resources to help the thousands of centers in the 12 parishes that we work here in Louisiana, let alone the other 52 parishes in the state. And so it was definitely a drop in a bucket in terms of how many people we were able to help with that. But it's true that just like a lot of small businesses across the country, the SBA went to bigger businesses that it wasn't supposedly intended for. I would argue that that's what happens when you create policy without equity in mind. When you roll out a policy that doesn't intentionally understand the systemic inequalities that lead to people not getting the resources they need, what you see is what we saw, where you see these like large corporations and these large entities that use loopholes to access funds that they didn't need compared to folks like childcare providers. But that's what we come to expect and exactly what the Trump administration is about. When we look at something that you talked about was wages, you're remiss to talk about this without talking about wages. So a story that I tell all the time, and I have an op-ed coming out in our state, the biggest state paper in the state here, The Advocate, this week about this, is my grandmother worked in childcare 50 years ago when she first came to this country. She made $12 an hour when you adjust for inflation over the years. Today, childcare workers are making on average $10 an hour. So we've actually gone backwards in our compensation for childcare workers. Many of these workers are middle-aged or older. And so when you look at that reality and you put it in the context of COVID, we're asking these folks to go back to work in a pandemic in which they are likely to be part of an at-risk population to get COVID and die from COVID with no health insurance for $10 an hour. And we're wondering why people don't want to come back to work. And so the graphic you have up there is true in Louisiana, where 40% of providers are reporting that their staff don't want to come back. And I don't blame them. Why would they? This work simply isn't worth it right now. As it was said in the video, social distancing isn't really possible in a childcare setting. So these women are doing what is literally dangerous work right now. And it is the definition of an essential service for our community, because I think anybody with a child at home has learned just how essential childcare is in the last 6 months. Just ask anybody who's tried to work and take care of their child or do anything else at the same time. And so to put it bluntly, these folks need pandemic pay, and it should happen the day after coronavirus started happening. And we need to be able to provide a real incentive for folks to return to work and stay in the work. Because even beyond just the pandemic pay part of it, childcare was already seeing a almost 50% rate of turnover every year, which hurts your ability to provide quality, which also hurts children, because children at this age, the healthy attachments is a huge part of their development growth. You can't have healthy attachments if the teachers are changing so rapidly. And so it hurts the quality we're able to provide this. Another thing about like how the pandemic is hurting providers right now is something that we talk about a lot in childcare. Is Louise Stoney, who has been for a long time a thought leader in the sector. She talks about the iron triangle, which is a term she coined about 10 years ago, where childcare functions on an iron triangle of needing to have full enrollment, full fee/reimbursement collection on time, and right sizing your costs compared to your market area. And if any of those three things are out of whack, then you're basically out of business because you're operating on such thin margins to begin with. And all three of those are completely out of whack for everyone all across the country and all across the state right now, where families are scared to send their kids to childcare, so people aren't at full enrollment. You're definitely not collecting all your fees on time, and you're not getting as much subsidies as you were from the state or federal government. And you're having to raise your costs because you don't have money to just cover your rising costs that I mentioned earlier. So you have to charge families more. And so all three of those things are not calibrated right now. And so what we're seeing is, I don't think it's an overstatement to say that both in the United States in general, but Louisiana specifically, childcare is on the brink of collapse without a bailout.
That's a perfect segue into talking about our call to action here. First, the good news, which is that early childhood education truly is a bipartisan issue. And how many things can you say that about right now? But truly there is at least some buy-in on both sides of the aisle, and certainly with voters, about the importance of early childhood ed. Of course, it comes down to a difference in how we want to tackle the issue and how important equity is. But 84% of voters overwhelmingly say that high quality, affordable childcare for families with young children is an essential service. That's especially true with younger voters and with women voters. And we're going to watch a quick video from a new documentary called Starting at Zero that highlights this. It's just going to be a 2-minute clip. And you'll hear from some governors and some experts about the bipartisan nature of this.
This is an American issue if there's ever been one. If we want to be successful, the most important single thing we can learn and do is early childhood education.
This is a nonpartisan issue, and governors all agree that if we're going to promote economic development in our particular states, we need to focus and invest in early childhood education.
This topic of early childhood just seems to be the one piece of education that governors are really starting to turn their attention to for a whole host of reasons, from wanting to improve their economy, wanting to improve the outcomes of their education system, and also have the supports in place for families. They understand the research, they understand the importance, and now it's really rolling up the sleeves and doing the work and moving it from the discussion stage or talk into action.
This is America's pathway to international success in the future in the digital age. If we don't do this job properly, we're going to be behind the rest of the world.
As a governor, I think that the most important legacy that we can leave isn't for today, but it's for the future. When it's no longer my priority, but it's a community's priority, when it's a school district's priority, when it's parents' priority, that's what keeps it sustainable. What we've seen in Montana, what they've seen in Alabama, what they've seen in other states, is that success begets success. And once folks see what a difference it can make for the child and the community, that's what'll sustain it. Once you're there on the ground, you know that it's investment that we can't afford not to be making.
So I would say that is the good news, is that there is bipartisan buy-in on the importance of early care and education. And of course, the catch is the how. So, sorry, I'm just switching back over here. So that brings us to our call to action. I'd like to definitely give Kenny the floor on talking about this, but essentially what we want to think about coming out of our session and coming out of this pandemic is how our states will use upcoming federal funds. This is a moment we're in that we have to seize. And as Kenny can explain, policies that used to be non-starters are suddenly actually possibly feasible, but the clock is really ticking and we have to be prepared. So Kenny's going to talk to us about seizing this moment. I will put up some pictures of resources that Kenny will talk through, but that we'll also make available to you. I'll put a link in the chat, but also we'll send them out after the event. So yeah, if you could tell us about how you're approaching this opportunity in Louisiana.
Yeah, so just a little background. As many of you may have heard, there's been continual debate about another coronavirus relief package nationwide that will likely not happen before the election, but will likely happen either in the lame duck session after the election or early January. And so I think my call to action for y'all and what I'm be spending all of my time with all of our partners with between now and then is being prepared for the moment that will come when another package is eventually passed. And something that our national partners have been very successful at doing is that we've been successful in getting past the point where the conversation is whether or not childcare will be part of the relief package. The question is how much. And so just basing my opinion based off of what we have heard been argued amongst the Democrats and Republicans is the Republicans have said somewhere between $15 and $20 billion for childcare in the next relief package, and the Democrats are asking for $50 billion. And so we know that childcare is likely to be in the next relief package, and it's most likely going to happen. The question is how much. To give you guys some scale on that, for who may not be who may not understand what that may look like for your state, is that here in Louisiana, the first COVID relief package, the CARES Act, had $3.5 billion for childcare through the Childcare Community Development Block Grant. We got $65 million additional dollars in Louisiana from that. So just doing the math on that, if the same scale is applied to the lower number, to $15 billion from the Republicans, that means Louisiana is going to get somewhere upwards of $300 million in additional dollars in the next relief bill. And your state, likely, wherever you are located, is likely to get somewhere around that. The number is going to be in the hundreds of millions that you're going to get if it's the lower number. And if it's the bigger number from what the Democrats are asking for, if we get 50 billion, we're talking about upwards of $1 billion for childcare for each state. So I think the thing that I would say to everyone is you need to be prepared for this moment. Do everything that, like right now, what you should be doing is preparing a slate of policy proposals to roll out to whoever's in charge of those relief dollars that will come down from the federal government eventually. Here in Louisiana, the Department of Education is in charge of the CCDVG. And we've already put them on notice that we're going to have a whole slate of policy proposals for them of like, here's how you're going to spend that money. We've done all this work to understand what's happening with providers and how best to support them. And so here's how we need to spend this money as a state to try and bolster this very essential sector. And so some of the things that I've been working on is one is a wage enhancement, pandemic pay I talked about. And Carrie has a picture of the brief there that she can share with you because I shared with her. The basics of the proposal is it would provide a 20-week pandemic pay pilot program in which all childcare workers in Louisiana would receive a $5 per hour pay enhancement as an incentive to return to work and to remain working. As I said before, the average pay is about $10 an hour. And so for all childcare workers, it would raise them to up to at least $15 an hour with this. In some places where folks are making more money, it will raise it even more for them. And so that's one idea that we've already created an entire plan around and built a brief and have a plan to try to put it into action. So that's one. Two is health insurance, which was mentioned in the first video we watched, where the majority of childcare workers don't have access to health insurance. And unfortunately, given the wages they often live right above the cusp where they don't qualify for Medicaid, but they don't make enough money to be able to afford private insurance on the markets, and the businesses they work for aren't big enough to offer insurance. So they're kind of screwed often. And so there's at least one state, New Mexico is the example that immediately comes to mind, that has done a really interesting thing where they're providing health insurance for childcare workers. Most states have created a high risk pool. Sorry, I said the pool really weird there. High risk pool for workers who need it. What New Mexico did is they said that every childcare worker who doesn't have access to insurance through either Medicaid or their employer is now qualified for the high risk workers insurance pool, and the state is going to cover their premiums during the pandemic. That's the type of thing that you can push your state to cover when they get another round of coronavirus funding. Another thing we're going to push for is raising childcare assistance rates. In most states, you're not paying at market rate for childcare assistance. And so you're putting both providers and families in a situation where the subsidies aren't enough. And that was also mentioned in the first video by that provider out of Maryland. Here in Louisiana, we particularly have that problem where we pay out CCAP at a rate that's only about the 25th percentile of market rate, which means that families using that money, if that's all they use, they can only afford 25% of the options in their market area. For most families, to qualify for childcare assistance, you have to be pretty poor. So if you still have to make up a difference of what is often a couple $1,000s a year, they simply don't have it to a family that's poor. And then what happens, what we know from our experience of working with providers, is that so many providers try to work with families. They say, come on, enroll the kid, pay the difference when you can, and they take the hit. And then that hurts their ability to provide care and quality care and pay their people. And so if we raise the subsidies for CCAP to market rate, we're able to provide families with assistance they need to actually access childcare. A subsidy that's like too low to actually provide access doesn't really help. And it also allows providers to provide actually quality care and maybe even raise the pay for their employees to a rate that's going to incentivize people to work and want to stay in the work. Something that we've been working on that we have already been successful on, and this is a perfect example where you talk about, Carrie, about ideas that were a non-starter not that long ago that all of a sudden are now very possible. I've been in this job for almost 2 years now, and one of the things I've really been fighting for the whole time is in Louisiana, we're one of the few states that didn't allow job search as an eligible activity for qualifying for childcare assistance. You had to already be in work or in job training or prove that you were in school. And so for thousands of families in Louisiana, the reality was they couldn't go to work because they didn't have access to childcare, and they didn't have access to childcare because they didn't work. And so if you're on the conservative side of things and you argue that job requirements for public service, for public benefits is to incentivize work, then you should allow people to get the benefits while they're looking for work so they can get work, if that was your point. But I think that's not their point. That we can talk about that a different time. Forgetting something. Oh, paid leave. Can't forget paid leave. And so another thing that we're working on is paid leave, where, to put it simply, we need paid leave for families to be able to take care of themselves, to be able to take care of their kids, and to take care of their loved ones. And so it's part of this conversation around childcare that has been especially highlighted by coronavirus. And so one of the things that we had produced is a brief that we worked on with a bunch of folks that we're going to be advocating on come the next special session in Louisiana, is a comprehensive paid leave policy. I think what has failed in a lot of states is that you're asking employers to take the full cost of paid leave individually, and like the business lobby is just too strong in this country, and specifically in Louisiana. So we took a little bit of a different strategy. So our proposal calls for 6 months of paid leave for new parents, up a minimum of 12 weeks for all employees to take for either themselves or taking care of their family. It also includes a sick leave policy where you accrue 1 hour for every 30 hours worked. And the pay structure is it's a state-run program in which both the employer and the employee contribute to it. And when you do it at a scale like that, as a statewide scale, it allows you to control the costs and also share the costs. And from the financial mapping that we've done, on average, the worker's weekly pay would be less than the price of a cappuccino, it'd be less than $5 per worker per week. And so this is very affordable and very doable. The question becomes political will to do it. And so those are sort of the major things that we're going to be preparing to push when the next relief package comes.
That's so much good concrete information. And Danielle had a question. We just have a couple minutes left. She asked, will you be sharing the specifics on how Louisiana spent CARES funding and what you're asking for in use of any future funds? Quickly,
sure, I can. I'm happy to share. I'm still working on it, but I'm happy to share a document after the fact about what we'll be putting forth as our proposals for what to do with future funds. In terms of how Louisiana has spent the CARES Act funding that was for childcare, was on a few things. They spent it, one, on providing covered childcare for essential workers, and that ate up a lot of the money, because what the state did is they waived all co-pays and they waived all income requirements. And they said, if you are an essential worker and classified as an essential worker by the state, you were eligible immediately for CCAP. And so we spent a lot of the $65 million that we got on that. We spent $10 million of it on direct grants to centers. We gave out grants of about $15,000 each to all centers statewide that are eligible for public funding. And then the third thing that we spent for, which was something that we advocated strongly for, was the state used a chunk of its CARES Act money to purchase and distribute centrally sanitation and other PPE materials that centers needed to be able to open. Because what we learned pretty immediately after the pandemic started was that folks were having, without being these large entities, they were having a hard time having the buying power or even the money to purchase things like masks, things like Clorox that they need to just keep the doors open. So those are the three main things that we spent basically all of the $65 million that we got from the feds on.
And I just put a link in to a childcare aware resource where you can find your own state and see how it's spending the funds. We'll also send that out after the event. We're in our last minute. Kenny, thank you so much. There's just so much to this. And I think, like Kenny said, it comes down to political will. We know it works. We know these years are important. We don't respect our providers like we haven't since the dawn of time for our youngest kids. Women of color taking care of children have long been disrespected, and it keeps going. And so we have to seize this moment. And I'll put in a link to Kenny's resources. But again, we'll share these afterwards too. That'll take you to a folder with the 3 documents that you just saw. And I'm sorry that we have to wrap it up so quickly, but thank you so much, Kenny. We really appreciate it. And thank you all for a great chat. And please feel free to contact me anytime with questions or concerns about your state. And we hope you'll take care. And I am supposed to tell you to go on back to Hopin. We have an awesome session with Ayanna Presley this afternoon, and then with John King. So head on back over to Hopin. Kenny, thanks for sharing your email address in the chat. And yes, Denise, join us for Ayanna Presley and John King sessions later. Thanks all. Take care of yourselves. Thanks, Kenny.
Good job. Thank you.
Thanks. Thanks, Bo. Thanks, Neil.